Cupping is a perennial favorite in the clinic. It was made quite popular recently because Michael Phelps showed up to the Olympics with cut marks all over his back. What we use it for is as a myofascial release, and what this means is we use suction to pull the connective tissue layer away from the muscle layer. In between the skin and the muscle layer lies the connective tissue layer, and this lies in giant swaths all over the body. And connective tissue is actually how pain travels. So if someone comes in with back pain that's radiating down their legs, it's traveling via the connective tissue. The issue is actually in their low back, and to unravel that pain, we will use cupping because it's much more challenging to treat pain in large areas than it is to actually treat it at its source. So next time around, we can just focus on one specific area to treat the pain. There are numerous implements for administering cupping as well. When I went to China after I graduated from acupuncture school, all of the doctors that I was underneath used bamboo cups. We don't use bamboo cups in the West because there's really no way to sterilize them. Instead, most practitioners use glass cups, also known as fire cupping. And the procedure here is you soak a cotton ball in alcohol, light it on fire, and insert it into the cup. That creates a vacuum, and then you place that cup on the skin. There's not a whole lot of control over the amount of suction when you use fire cupping. And so the past few years, I have started using what's called pump cups or plastic cups that allows you to tailor the amount of suction depending on the sensitivity of the patient. So I can pump it once, twice, 3 times. Usually I pump it 6 times, but if it's too intense of a suction, I can very easily release the pressure or do it again with less suction. Because cupping uses suction, it can leave discoloration on the skin. They kind of look like bruises, or what I often tell my patients is to tell their significant other that they were attacked by an octopus, because that's kind of what it looks like. Depending on the severity of the discoloration will dictate how long it will take for those cut marks to disappear. Sometimes they'll be quite light and they'll be gone within a couple of hours, and sometimes they'll be very dark and they may stick around for a couple of weeks. The cupping areas can be a little bit sore after treatment. This shouldn't last very long, a couple of hours. Traditionally, it is advised that you keep whatever area has been cupped covered with your clothing for about 48 hours because the skin is dilated in that area. And in Chinese medicine, we believe through that dilation, you can catch colds, flus, viruses, things of that nature. What cupping is doing is it's actually pulling stagnant blood out of the muscles to the surface circulation. So if you have a lot of stagnation in a muscle, you're going to see a lot more discoloration. Strong discoloration is also seen if there's a lot of toxicity in the area. I often use cupping over lymph glands to help the lymph system purge itself of the toxins that it pulls out of the tissues in the body. And if there's a lot of toxicity, you'll see that over these areas because there'll be more purple discoloration. In all honesty, either you love cupping or you hate cupping. Some of my people come in requesting it, and some request that I don't do it at all. It really just depends on your constitution, and you'll never know how you're going to respond to it until you try it.